Hi, my name is HoChong Gilles. I'm a nurse practitioner working in hepatology for the past 25 years. I'm the clinical program director at the Central Virginia VA healthcare system in Richmond, Virginia. One of the most common questions that I am asked is, how do they risk stratify patients if they do not have access to a FibroScan? So I think one of the things that we need to do is to learn how to calculate the FIB-4, and many primary care providers don't provide that information when they do refer patients for either elevated liver enzyme tests or they found an incidental hepatic steatosis. And common questions that I get is, how do I risk stratify without all the bells and whistles that hepatology offices have in community GI practices? Well, first, it's important to initially do the cutoff of calculating the FIB-4, which is based on all you need are 4 parameters. You need the patient's age, the ALT, the AST, and the platelet count. So a hepatic panel and a CBC will do. And then you can do a calculation for the FIB-4 if it's not already incorporated into your electronic medical record. I use MedCalc all the time and to calculate the FIB-4. Unfortunately, where I am, it does an automatic calculation for me as long as if the available lab tests are available. So you want to do an initial risk stratification of, doing the 3 buckets of either low risk, which is a FIB-4 less than 1.3. And then the high risk is you just have to remember a FIB-4 greater than 2.67. And anything in between is the indeterminate range. I do know that access to FibroScan sometimes is very problematic depending on where people are, working and living. And so one of the things, if you don't have access to a FibroScan, you can conduct other lab tests. It is a proprietary lab test. So in the guidelines, they recommend doing an Enhanced Liver Fibrosis test, which is called the ELF. And you can order that through Quest or Labcorp. It's a lab test from Siemens, and it will give you a score. So it ranges from 7.7, and anything less than 7.7 is determined low risk. And anything above 9.8 can be indicative of significant advanced fibrosis, which is, again, what they define as fibrosis stage 2 to 3. Of course, the higher the ELF score, you want to make sure that you want to rule out, significant scarring, which is cirrhosis, which is F4. So if you don't have, FibroScan, there's other biomarkers that you can use to help also identify risk and determine either if they have low probability to high probability of advanced fibrosis. So, and there are many apps out there that, like including MedCalc, that can calculate the FIB-4 score for you. But also, if you don't have access to the next line of a non-invasive test, such as VCT, FibroScan, then I would recommend drawing an ELF test. So I appreciate it and thank you.